Welcome back, everyone, to another fabulous episode of the Healthcare Trailblazers podcast. Super excited to be sitting here today with the wonderful Dr. Greg Burrell. Am I pronouncing that right? Burrell, right?
Yes, that's
Burrell.
right. Yep.
Fascinating career. Young guy, done a ton of stuff. Really excited to hear about a bunch of various chapters. The man's a doctor. He started a company called Carbon Health, which it sounds like a really cool company. Excited to hear more about it. And then just did a bunch of really cool things, and then started something new very recently. So excited to hear about all of it. Greg, thank you so much for sitting with us today.
Sure. Yeah. Thanks, Mendel. Glad to be here and chat with you today. It's fun to talk through it.
Absolutely. So, all right, let's take a jump back. Where'd you grow up? How'd you get involved in healthcare?
Yeah. Well, I grew up in Utah, Salt Lake City.
Okay.
We actually born in Hawaii, and then early in childhood moved to Utah. So grew up in Utah, and then I made my way to Chicago for undergrad, and I was there. And I wasn't actually planning to go to med school. I went into kind of like strategy and management consulting. Thought I was going to go to business school, go that route. But I think I did, was interested in more of the kind of financial aspects of, I think it has led to me being interested in more of kind of the financial aspects and making sure that we make, care affordable and things like that within healthcare. So then I decided to go back to medical school. And so I had to take some classes to go through that. I stayed in Chicago, went down to University of Chicago for medical school. And then I decided to stay broad. Wanted to focus on internal medicine, stay broad within healthcare. Honestly, initially I thought that my healthcare path would be to become a specialist, go into pulmonary or cardiac care.
Okay.
And just kind of be a practicing doc. That's what I thought for a long time. And then it changed somewhere along the way, probably when I was in residency in San Francisco.
Okay. You're like, yeah, I had to take some classes. It was medical school.
Oh, I had to take some classes even to get to medical school.
Okay.
I had to go back and do whatever they call post-bac. So I had to go back and do that. So
gotcha. And how long was that process to get into medical school?
Well, it was about because it's about 2 years.
Oh, wow.
Yeah.
Okay. And then medical school is what, 7?
Medical school is 4.
4.
Yeah, and then residency is 3.
Yeah.
So it is 7 altogether.
Yeah,
but...
so it's inclusive. That's awesome. Okay, so you go to medical school. You thought you were going into specialty. You figure, all right, I've got a bit of a business brain, which is, I think you'd agree with me, is somewhat unique in for doctors. I think it's kind of that magic combination. A lot of the doctors that are doctors and business people, or we've had on here a couple that are doctors and lawyers, that kind of interesting combination is I think somewhat unique. So good for you. That's cool. So you figure that out and you say, all right, so what do you do? What do you do from there? You get out of residency. Where do you go?
Yeah. So I'm in residency. And I'm, think that I think I see all these kind of challenges. I see that the system doesn't have the right incentives. The fee for service system kind of incentivizes, more spending, kind of, there's not really any accountability for the kind of outcomes and the clinical quality that go on. And there's no real relationship between like the cost of care and the quality of care and all these things. And then it's an antiquated industry where, it's using, 1980s technology and, hasn't really gotten up to the digital age in any way. And so all those things are kind of, kind of eating away at me. And I think that was around the time also of the passing of the ACA, of Obamacare, so to speak. And I think that, that started to change the incentive structure. It felt like, and it's been a long road, but felt like we were making that road towards value-based, and towards paying for value, paying for quality, not for quantity. And so all that got me interested to think about how can I dive into that a little bit more, and how can I dive into kind of changing the model. So, but nonetheless, I was brand new doctor. I wanted to still get experience. And so I went to work. I stayed on at UCSF as faculty after I finished residency.
That's cool.
And I went to work as a kind of a hospital medicine based doctor at UCSF.
Okay.
And then I was starting to on the side, consult for companies. So I started to consult and help with a company called Care Message that was doing chronic disease management. And they were thinking about, how can we have text message based campaigns and education, like meeting people where they are, more SMS, more like mobile based. This is 2013, so we weren't as much into the mobile era, but it was getting there.
Yeah.
And so we were starting to do that kind of education through that way. And that was my first introduction. I really just did kind of medical knowledge for them. I'm helping them make a campaign for diabetes, high blood pressure, things like that. But that really piqued my interest in getting deeper into kind of product, into building a software. Like, how can we use technology to kind of build something that's innovative, that's going to be more in line with what our customers, what patients expect, more in line with kind of using technology to improve care over time.
Mm-hmm.
So that's what got me, like, piqued my interest, and I started looking around for somewhere. I was thinking about joining somewhere early stage, somewhere with 20, 30, 40 people. I didn't go into this thinking I was going to co-found something initially.
Interesting. So then you accidentally co-founded a really big company.
Well, yeah, along that pathway, I met my two co-founders, Aren and Tom, and they both were from engineering side. They're both from the product side. Aren had been Aaron had been a successful entrepreneur before. He'd been the co-founder and CEO of Udemy, which is a really large, very large online education platform. They're now a public company, and so he had grown a company before. He kind of knew those things that I didn't, which is he knew the venture capital world. He knew how to hire engineers and how to build products, and so that was super exciting to me. And I was really coming with the clinical edge,
right.
And so bringing kind of that clinical edge to it. And we actually, it's a funny story. We actually started out with an entirely different idea.
Okay.
So when I first joined, we were actually going to make collaboration software for doctors.
Okay.
And we were going to have, like, doctors bring cases to this community that would then be discussed and would be, like, have expert opinion and things like that come in, but it was going to be kind of like doctor initiated. And we got, maybe 2 or 3 months into that. I left my, like, full-time job. I was doing just a little bit of clinical on the side at this point. I left that full-time job and dove into it. And then we decided, like, let's shift it to something that we're actually kind of both more passionate about, but also feels like it fits better with the way that we could make something happen. I think it just took us some time to get comfortable that we were going to do something much bigger. Doctor collaboration software was like a nice, comfortable, small company to make. Mm-hmm. And it just took us some time to come around on the idea that we could, actually make something that had the potential to be larger.
Wow. So what was that? What is Carbon?
So and even the first iteration of that was, we said, let's make software so that you can have the first, like, entry point was, let's make software that makes your experience as a patient much more seamless. Okay. You've got a nice, like, super smooth onboarding to, through the app. You can always, it's a hybrid approach. You can always get virtual care if it's a virtual visit, amenable to a virtual visit. And then, but we've got physical locations available for you if you need it. Wow. And we said, let's make the back end. We're gonna own the back end as well. We're not going to use an EHR. We're going to create our own, which is the thing that a lot of, like, people do when they get into the industry. And I don't know if it was a good decision or not. I think it certainly has its pros and cons. It's a big kind of surface area product to work on an EHR.
Right.
And
how complex is it to get that certified, though?
Yeah, it takes time. It really, it took us, like, I feel like it took us about 2.5 to 3 years of building before I felt like it was like a good product.
If you could do it again, would you buy or would you rent, so to speak? Excuse me, build or buy,
or buy. Yeah. Nowadays, there are. The ecosystem is honestly substantially more built up than even it was in 2015. And so I think it'd be a much more compelling offer to kind of to buy a backbone. And there are some companies out there that offer kind of a backbone service, where they do all these things that take certifications, right? They'll do the integrations and things like that. That's what takes time. Integrating with LabCorp, integrating with Quest, getting, like, your e-prescription so that you can send electronic prescriptions to all the pharmacies in the country, and getting certified as a EHR certified technology with the government. Like, these are things that take a long time.
Yeah.
And so, that backbone, and then they let you build your kind of like, your special sauce, your patient app and all that on top of it. And I would say that is probably like the better way to go now. But that being said, like Carbon has a lot of freedom. They could kind of shift really quickly into COVID activities. They could add on vaccination and testing and all that, because they had, they owned the backbone. They didn't have to like wait for a vendor to build something for them and things like that. So it does still give you some flexibility, but it's a bigger endeavor for sure.
How did you actually build that? Like, I'm sure you had to take on investor funds for something like that.
Yeah, I mean, we started out with with seed funding. We kept the team quite small. I mean, I was I continued to be so kind of impressed with our like early engineering team was really small. It was 2 or 3 folks. Wow. Tom Barry was incredible. He was our like co-founder and CTO. And we really worked together to write the first version of everything over about like 9 to 10 months. We did that, and so our initial idea was actually we were going to license this software to clinics and create kind of like a network so that you could kind of like an open table type of approach where you could go on and see what are the restaurants or what are the clinics that are on this. And you would know the idea was you would know by going to, this network that you would get a certain level of service, a certain level of like experience because it had been, because this clinic was using the Carbon Health platform. That was the original like go to market was that. But we said, well, we want to really test this and we want to really iterate our own way. So let's make our own clinic, but not necessarily with the intent that we would scale a ton of clinics ourselves, but that we would make it as a pilot site. So we built this first clinic. We opened up all of the, kind of practice and everything to have that. And I oversaw that and oversaw our first clinic. And we were really right next door to the engineers. We were kind of like, we'd go back and forth each day to just kind of iterate, how's the product working in the clinic and how are the patients liking it and all that, how are the doctors liking it, everything. So that was the first iteration. But I think that we realized over probably, it took us a year and a half or so, but we realized if you you sell a software, you sell a license to like a practice with the wrong incentives again, that they're not value based, that they just that they want to make revenue in this same kind of CPT environment that's out there.
Yeah.
They may not want to message with patients. They may not want to do anything proactive, virtually, things like this. They might want to just see, right, where's the code? Where, where am I going to get paid for this activity? Things like that. And so we couldn't, it was hard for us to guarantee the same kind of experience at every clinic. And so that's when we really thought more significantly about, okay, we may want to actually become a vertically integrated company.
Wow.
And have the providers, have all the providers in-house doing this kind of primary and urgent care. So, wow. And that's about when we kind of made that flip to do that.
So how many investment rounds did you have to do once you pivoted from the collaboration software to we're going to become a footprint? We're going to become.
Yeah. Well, over the years, Carbon has taken on many investment rounds. Mm-hmm. They were smaller at first, I think, as we were trying to find that kind of product market fit. And so, our A round was especially as you've seen inflated A rounds during the pandemic, our A round, I think, was like 6 or 8 million. It was, right. It was, I mean, pre-COVID, that was kind of like could have been a normal A round.
Right.
And then we took a B round, I think in 2019, that was 30. And then, and then in the pandemic times, like took larger rounds. So I think, a C that was 100 and then a kind of a private equity growth round about a year ago from Blackstone that you may have seen that was larger. It was
I did. That's awesome.
So then, then they really got larger at that point when they really wanted to, I think, scale more of a physical footprint of clinics across the country.
I know I'm kind of digressing for a second, but I think it's fascinating that you built up this organization. So I'm going to ask,
sure.
What are some of the advantages and disadvantages with building an organization with investor funds? The advantages are clear. You have money. What are some of the disadvantages that you think are there?
Yeah. I mean, I think that, I think one of the things that you do want to think about, like as a founder and as a, or somebody that's involved with that process of fundraising is like, will these investors be good partners for us? And do they have some kind of incentive that's different or things like that? I did now, so I did kind of have I had a little bit of like concerns because one of our investors was a large like real estate fund. And so, are they going to kind of like push us to have more clinics versus more virtual, even if like virtual made more sense? Now, that's been absolutely not the case at all. They've been incredible partners, and they've just said like, this is kind of you guys really think about, you guys are the kind of experts in what to do. They mostly have interacted with Aaron, the CEO, but I'd say that they really have been incredible partners, and kind of like deferred to however we feel like is the best fit for the business in terms of growing. So I think that's worked out well, but certainly those are some things to think about. And I think one of the things that was harder for Carbon Health, or took a little bit longer, and now it's happening, which is great, but it has taken a little bit longer, is to make that transition into more value-based care, and to kind of get into these contracts with payers that are more based on capitation or things like that, because it is challenging. I would say we did not have a ton of like expertise in that area in the early company, and so the kind of most natural path for a clinic or a provider group to go is those basic kind of fee-for-service contracts. If you get too large with those contracts, like it can be hard to steer the kind of fabric of the company in a new way. I think we always wanted to get to that, and so that was the good part. We were building the software like with that in mind eventually, and all that, but there's been some work, as they've, you probably saw that maybe the Carbon Health recently kind of signed a deal with Blue Cross Blue Shield of Massachusetts to kind of be accountable for some of their primary care, their kind of virtual primary care, and they do have a value-based arrangement with them. And so they've had to make sure, like, well, we need to make sure that we got the software and the team structure and all that in place to get there. So that's been a little bit of a forcing function, which is great. But I think Carbon was always on that pathway, wanted to be on that pathway. So they were thinking about it. But if you're really big, all fee for service, you see this with hospital systems, where they still driving most of their revenue from orthopedic surgeries and things like this. And so it's hard for them to shift the gears and move into kind of a value-based arrangements at the same time.
Absolutely. I think one of the fascinating conversations we've had actually on this podcast was Dr. David Pate, who's the CEO at St. Luke's. And what was so cool about what he did is he built them over a 10-year period into a $3 billion a year organization, but a third of their revenue, $1 billion, was full risk value-based care. And he did that from within the confines of a fee-for-service environment. So, that's
incredible.
Yeah, like to start from scratch and do risk is hard enough as it is to get it right. To do that within the confines of a fee-for-service environment is mind-boggling. So,
tough to do. For sure.
So Carbon is continuously moving in a VBC direction now.
Yeah, I think that they've branched into a couple new areas. One is more of the virtual primary care and value based. Another is around kind of remote patient monitoring, thinking about how to have more care from home. Whether that obviously that means virtual, but also that means monitoring folks at home more easily that have diabetes or may have respiratory conditions, and kind of helping them to stay at home, to stop those conditions from escalating and getting worse, and then needing to have more acute visits like inpatient stays and things like that. So using kind of technology to help keep people comfortable at home has been another new area. You may have seen they had an acquisition of Alertive Healthcare last year, which kind of helped launch their way into that segment as well. And they brought on Myung Cha from Apple, which he was essentially leading health strategy at Apple. He was really a senior exec at Apple, and had been there for several years. He did a huge amount of the growth of the Apple Watch and all that. Brought the way that the Apple Watch has expanded into ECGs and payer partners and on all of that. And so he's no stranger to kind of remote monitoring and thinking about how to do more care from home. And so he's been an incredible addition to the team as well.
So here's a fascination of mine I'd love to hear your thoughts on. And, we one of the programs we offer here is also a remote patient monitoring program. And, specifically with the Medicare RPM program, right? Codes 99454, 99457. A lot of RPM companies forget to mention when they're selling the hottest, latest RPM is that patients actually have to take 16 days of readings, not 16 readings, 16 days of readings in order for it to be billable. And so a lot of the tech companies and device companies, they love to hype it up. But the people that are actually implementing it, people like Carbon, people like us, know that that's actually a huge challenge to get a patient to take their vitals every single day. And it's a large conversation. I ask myself this every day, like, what would my doctor have to tell me to get me to go to the gym one more time or make a different health decision? So, and I don't really know what the answer is. And that's me. Forget about, now imagine I was 67 years old and in pain and this and the other.
Right.
So, I'm curious if you have any advice or opinions on how to actually get the patient on board. When you talk about the incentive structure is skewed, it's making a lot of progress with value-based care. It's definitely trending in the right direction, but it still stops before the patient.
Right.
How do we get the patient?
Yeah.
Any ideas?
Yeah, no, it's such a great question. And it's such an integral one, obviously, because you can have all these, great ideas and all of that. But then if your patient's not interested, then they're going to fall flat. And so, it's such a tough idea. I think one thing that has been, impressed upon me over the years is really just that healthcare is such a team activity, and that, doctors play one part of it. Doctors, play a helpful part in diagnosis and treatment and, deciding kind of some of the treatment plans, the medications, and things like this.
Yeah.
But there's such another element to it where, nurses and coaches and physical therapists and nutritionists and, dietitians and others and pharmacists, really fit into this. And that there is such a, motivational component and a kind of like a buy-in, where I just think it's such a team sport. I think the traditional like healthcare 1.0, where you had a visit, you have a visit once every 3 months with your doctor, and then you're just kind of on your own. But between then, that just, it's so antiquated, it does not work.
Right.
And so, and we've got the tools to do something better. And so I just think that, the combination of like making it more mobile, making it more like much more longitudinal, and then making like people who have many more touch points with the patients, but are lightweight touch points, right? Like maybe even just a minute or two to just check in. How's it going? How you doing? How's the meal plan going? How's your, how's your glucose checking plan going? All that kind of stuff. I think like that's such an important part of it, to just get people on board and really feel like they have a team supporting them. I think that's part of it. I think that this is all like a new area for patients going into, and certainly people are motivated, I think, if they're having pain or discomfort or things like that. But there's a number of ones where, you could have a A1C that's kind of out of control, but you don't feel anything, right, for a very long time. So there's many things where, you really have to like just kind of get a better believe and have a team supporting you that says like, okay, this is for the best, even if I don't like feel anything right now.
Yeah.
So, yeah, but no easy answer there. I think that that's part of the solution, but it's work. That's the like.
Yeah. And don't get me wrong, I'm not looking for a definitive answer or a press release. Yeah, I'm curious about your thoughts, and that's.
I think the team-based approach is like a good start, at least.
Yeah, that's pretty solid. Do some chronic care management, people. It'll help.
Exactly.
You got to do it in the right way, and that's the tricky thing, and that's where education on your care coordinators and training and understanding how to talk to patients and how to really pull the patients into the conversation is really such a big deal. Yeah, absolutely. Cool. So you were with Carbon for about 7 years, right?
Like five full time.
Okay.
Yeah, 5 full time.
And then you kind of transitioned out. What brought that about? How did that go?
Yeah. It's a kind of interesting story, and I like to, think back on it, like, what if it had gone different pathways. But I think, overall, I would say, like, I kind of grew up in the healthcare system with Carbon. I got a first job out of residency at actually I was practicing at the VA healthcare system as a hospital medicine, so inpatient for the veterans. It's obviously a great organization. Really love what they do, and big advocate, but a big organization. I wasn't a decision maker there. I'm just there to practice medicine. And so and then I was kind of helping out of care masters on the side, and so Carbon was really my first, like, foray into seeing, like, how do you build a company, how do you build a business, how do you make it effective, and things like that. And it was an incredible, like, learning experience. So many ups and downs. It really is. I sometimes talk to founders now, and it's an emotional roller coaster. There's, like, I mean, for me, one of the things that I found, like, challenging to always, like, focus on was, in that first, like, maybe 2 years, maybe let's say 2 years, you have, like, a meeting with somebody, it doesn't go that well. They tell you, like, oh, this, maybe with investors, somebody, they tell you it's not going to work. And you just leave, like, dejected. You're like, oh, maybe we're going to fail. And you just kind of have to pull yourself up. And then you have a good meeting, and you're just like, yes, this is working. This is clicking. Let's go. And so you just get super pumped. But so there's big highs, low lows. And it was, it was a great experience. But I felt like I kind of grew up in the system, and I was really, like, anxious and excited to get to kind of population health and to think more about value-based care. And the pathway for Carbon, like I said, they're getting there, but back in early 2020, like, it was slow. It's just starting. And I kind of wanted to see what that looked like, to really think, like, where the core of the business is kind of that population health, that care navigation, and that, that kind of really getting people to the right type of care at the right time. That was very intriguing to me. Mm-hmm. And so I decided to think about taking a role at, like, a larger company. Now, Carbon's pretty big now, but at a larger company, that really focused on care navigation. So I went to Accolade, which is in the, solidly in the care navigation space and patient advocacy space, and went to go kind of, they had one core product. I went to go help them with their population health, and with also expanding to new product areas, to thinking about, like, what are some areas where we can take our one core product that's working and expand it. And they were at a kind of pivotal place where I joined about 2 months before they went public. And so, they were going through all that excitement of the kind of IPO and everything, but then they really needed to think about, like, how do we expand, so that we have more of a product suite, rather than, something. And so they'd already been starting on that course, but I was, like, there to help them with that. And so we rolled out a couple of new products. We had a couple of acquisitions during the past year and a half or so. But that was, the impetus for it was really that I was interested to dig in on population health and that kind of care navigation aspect of things. And so that was the opportunity to do it. It was a tough decision, because Carbon was kind of, it was our
like your child,
our baby. Yeah. And so it was a tough decision. I talked with Aaron and the other folks a lot, but I think we at that point had become a pretty well-cushioned kind of clinical org. I was like leading a lot of the kind of clinical aspects of the software and thinking about the product a lot. We had a chief medical officer at that point that oversaw all the clinicians. And so I think we were in a good spot where, I wasn't leaving a hole, and they were really doing, they were on a smooth course themselves. But yeah, tough decision. And, but that, went to Accolade. Experience was great there as well. So, it was, I think a good choice overall, but one that, I think about because it was kind of like my child a little bit.
Grew up and moved out of the house.
Yeah.
18-year-old.
That's right.
Wow. What an experience, man. That's amazing. That's awesome. So how did that go? The new company, Accolade, you said? Accolade goes public. How was that?
it was a wild ride. I was there for 2 years, and I just started, I just started somewhere new, and which I can talk about in a sec. But it was a wild ride because we got went public like kind of as things were really jumping up during the pandemic, and people were really getting excited about virtual care and new innovative care models, kind of like Accolades and things like that. And so there was a lot of we were like trying to really ride that wave of some of the healthcare consolidation that you're seeing right now. And so I think there's been this huge trend where a ton of companies that started point solutions. The kind of old like adage was, start a point solution. Healthcare is complicated. Just take your niche and then, go sell it, or go pitch to employers, because employers are easier to pitch to than payers. But now employer market's really saturated. They're getting inundated with questions, and they're, and they do have some point solutions, but they want them to work together. They want their ecosystem of point systems to work together better. And so that was where, Accolade was at. But I think Accolade had to add on to their portfolio to be able to kind of like, move from being point solution to being a platform as well. And so it was an exciting time. We rolled out a mental health partnership with Ginger. We acquired Second MD to bring, second opinion or expert medical opinion in-house.
That's cool.
And so that, that brought us like a little bit more kind of into a little bit more direct competition with Grand Rounds, or, Included Health, a little bit more direct competition with Teladoc, who has Best Doctors. It made us a little bit more of a notable company, but also, in a league with some big competitors. And then acquired PlushCare to move directly into care delivery ourselves. And so, kind of made our way into actual virtual primary care, virtual medicine. So an exciting move as well, but then also like continued kind of moving in that direction.
Wow.
So a busy
ride.
time for sure over that time. Yeah. With all the, bunch of acquisitions and growth.
That's amazing. All right. So what's the new play?
Yeah. So then I was recently thinking about what I kind of wanted to do next, and found an opportunity to go to Gravie, which you may have heard of. But
hopped on that Gravie train, didn't you?
I hopped on the Gravie train, indeed. Yep. It's about the gravy on top, saw the choose your favorite pun.
Yeah.
But
I'm a dad.
Yeah,
I have 2 sons. I'm allowed.
Yeah. Oh yeah. Bring on the dad jokes.
Go on.
No, but I think a couple things, really appealed to me about Gravie. I think that Gravie's building a health plan. They are a health plan, and they're building a more robust health plan. And so I think the idea, again, as I mentioned, I think the idea to be able to help kind of organize and coordinate that care for people, the right kind of care, is really valuable. So I'm really excited about that. I love the Gravie's simplicity. Has been, profound to me, which is that they offer kind of just all routine care for no cost. So that's when you're a member on the plan, you get primary care, you get specialty care, you get labs, you get so it's not just preventive. It can be any kind of all your kind of routine office visits. All that is just covered under the plan.
And it's a private insurance, or it's Medicare funded, or
it's commercial insurance. Okay. So it's aimed mainly at employers, and so you just that really with the theory and the thesis that this kind of incredible access to care helps people get care earlier, and helps people get the care that they need up front before it gets out of hand and they have to go somewhere more urgent, like a ER or an inpatient and all that, and that they just get their care under control, and then over time that actually improves the improves the outcomes, improves the cost for everybody involved, for the member, for the patient, and for the employer as well, or for the payer.
How many states are they in now?
They are in most. I don't remember the exact number, but most. So they're in most states at this point.
Are they in Pennsylvania? Do you know?
I think yes,
oh, yeah?
They are. Yeah,
cool.
Yeah.
Gotta look at that.
They are in Pennsylvania. Yeah. And what else was I going to say? Oh, and the other thing I like is that they, they have kind of a target of, and they tend to work the most with kind of small to medium size employers. So employers that may not have been able to otherwise kind of self-insure. So they have a lot of employers like in the 70, 100, 200, 300 employee size. And so it just feels like it's really, I've always had a passion for something that just feels like it's very mainstream. I think that was always Carbon Health's mantra, and no membership fee for Carbon Health, no just like use your insurance, and we're really we fit in just as well in and we're not one of these companies that kind of like only fits in New York and
Right.
and LA and Miami and or wherever, but that like fits in just as well in Kansas as it does in the Bay Area or wherever.
Right.
And so I think Gravie is very much that they that they're kind of helping to democratize some of these things, these programs and benefits that typically had been only available to employees of really large companies, and so they're kind of helping to do that work up front and then be able to pass that on to the employers in kind of a unique way. So have really liked that about it. They feel that, to me, they feel like they're a very product-led company, a lot of, very mission-oriented, which has been exciting. The exec team there, Abir and Marek are great folks.
What's your role there again? Sorry?
I'm the chief medical officer now. So, yeah. So, chief medical officer, and, we'll kind of, I'm their first chief medical officer, so just bringing that kind of medical function onto the team, and so I'll be building a team there for them over the coming months.
Wow. Well, it sounds like Gravie deserves a congratulations, because it looks like they're the ones that got on the Gravie train and got an absolutely perfect package with so many different levels of experience to bring together. So it's going to be fascinating to see what you guys accomplish over the years ahead. And Greg, thanks so much for sitting with us today, man.
Yeah, thanks, Mendel. It's been fun to chat through. Maybe I have one question for you if we have time before we go. What have been some of the highlights of folks that you've chatted with, and some kind of impressions that people have left on you that have been excited, that you've been super excited to hear about over the kind of
the man turns the tables. First person on the show, ladies and gentlemen, to turn the tables.
Okay.
We're breaking history here.
I'm curious to hear. You get to hear people. And also for me to think about. I wish I'd passed on more tidbits. I don't have too much wisdom to pass on. I wish I had. So.
That's a great question. I actually today, I had back-to-back today. Just got off with the chief strategy officer at the Innovation Center at Medicare.
Cool.
So that was an interesting conversation to kind of hear their perspective. I'd say some of the highlights for me have been Gordon Chen from ChenMed. I've been re-quoting that conversation over and over again. They're doing really, really well in the full risk space. Really, really fascinating. Yeah. And I literally have said this so many times. I feel like a broken record player, but he basically said that, and it's so simple but so profound at the same time. He basically said that in order for them to take on full risk, they actually have to get the patient to change the patient's behavior, like the actual patient. They got to get the actual patient, like we discussed earlier. So he said what they do is they expend an incredible amount of resources in training their doctors to become experts in persuasion, not just medicine. And that makes so much sense to me. So that was a really good line. Really enjoyed that conversation. Dr. John White, the chief medical officer at WebMD, obviously huge. They get 70 million people on their site every month. He's just such a based, grounded guy, super humble, super accomplished. He spent time at CMS and the FDA and the Discovery Channel, and he's done a lot. He actually just launched a course on LinkedIn called How to Think Like a Doctor to Make Executive Decisions. Highly recommend. It's about an hour, and he basically, he gives you like the lens of a doctor in how to make executive decisions. So cool course, great guy. Love that one. Dr. David Pate was great. Honestly, just so many, but
sounds like a ton of great conversation.
It's been people. Yeah, it's been a blessing. It's wonderful to talk to people.
Yeah, the ChenMed organization feels like they just are culture and mission rock stars, in the sense that they're really really able to innovate in a way that I think few, if any, have. So incredible.
Yeah.
And and continuing to do that at large scale. So really
Yeah. You can
incredible.
feel it just going through their LinkedIn.
Yeah.
You can feel it. It's
Yeah.
pretty cool.
Cool. Well, thank you for letting me turn the tables and put you on the spot for a
Absolutely.
moment. But good to hear some of the many tidbits you've learned doing this. So